Burhanuddin, Senior Research Officer at IKIM. We are on the fourth episode with Dr. Adi Setia, our esteemed guest, to discuss on the subject of Islamic ethics in engagement with life, health, and medicine. In the previous episode, Dr. Adi gave us an enlightening view, basically on how Muslims of the past have understood the notion of health and its implications, as well as the necessary axiological and theological commitments that is imperative for the contemporary Muslim to, if I can say, redirect the conversation as well the practice in this field. Now, Dr. Adi, in your article, you've also mentioned the imperative to consider our cosmological and ontological commitments, something that is traditionally discussed by the Muslim theologians and the metaphysicians or the Sufis. Perhaps you could enlighten us in terms of how do you bring these insights of the great ulama of the past into the picture, into this subject. Please, Dr. Adi.
Okay, thank you. Assalamualaikum. Bismillahirrahmanirrahim. Again, I see when we talk about theology, the thing is that in the past, all doctors, like all Muslim tabib, they were already grounded in Islamic theology and cosmology and psychology and metaphysics. I mean all those disciplines were already in the background education way before they became specialized in tip or in medicine, right? So when we talk about theological commitment and cosmological commitment and so on, all those were given, right, in the educational setup before they became specialized in medicine as a vocation, right?
Yes.
So anyway, so I think that's one point. So anyway, so by cosmological commitment mean a understanding of the nature, structure, and processes of the natural world, I mean the physical world, including and by the physical world it means all aspects of the visible world. So it's not just physics, but so it includes chemistry, psychology, because human behavior and language and thinking can be experienced, can be felt, and can be observed. So that is also comes under the physical world. So again, I mean, okay, already our notion of the physical is much bigger than the modern notion of physical. So it includes also the psychological, and that means and that means also understanding the relationship between physical causes and psychological effects, and also psychological causes and physical effects, and the nature of the cause effect relationship in general. So in general, we understand cause and effect. Say you have a disease or like a pathogen or some other non-pathogenic factor, and that causes the disease. So that cause there is more like a habitual correlation rather than a one-on-one direct cause, because there's just so many factors that they're going to infect, and the identification of a particular cause as a singular cause is largely a matter is largely arbitrary. So here, so Muslim tends to understand cause and effect more in terms of predominant or habitual correlation rather than one-on-one efficacy. And therefore, this in turn have impact on methodology, meaning it allows for it allows the physician to be open to alternative treatment protocols. Even if, let's say, a given a treatment protocol is effective, right? Let's say, but that in itself does not preclude other treatment protocols to be more effective or to have less adverse effect, right? So I mean, so there is more pragmatic or more purism, or more varied methods in treating or in treating an illness. So it's not stuck in the current biomedical synthetic drug treatment protocol. So it's much more open to other promising treatment protocols. And therefore you find that when you look into the content of Islamic medicine, what you find is like a integration, a critical integration of the best practices in Chinese medicine, in Indian medicine, in traditional Arab medicine, right? In Greek medicine, right? Plus traditional prophetic medicine, which mostly based on nutrition, based on nutrition, on diet. Yeah, so I think, and so that means in terms of methodology, then the overarching methodology is that of the Lakatos, is that of what that famous philosopher of science has mentioned about a science or a paradigm as a scientific research program, so which can be modified, which can be added on, and so on, and that's open to other possibilities and not too close-minded, right? Yeah, so that's cosmology, and then as regard ontology, and anyway, so here what's important, we recognize that that a disease can be due to some biological pathogen like a germ or a virus or fungi, but it also can be due to some social factors. So there is also like the of social reality, and also it can also be due to some physical or environmental factors. So that there is a constitution of cosmic or physical reality, and so it can be due to some spiritual or emotional or mental imbalances in the patient. So that is a recognition of the mental or spiritual reality. So so that means so that means we have a more nuanced understanding of reality, and we do not reduce and restrict reality to the purely physical microbiological aspect as the only reality that is worth considering.
Yes.
So that means and that means we recognize that the body, that the emotion, the mental, and the spiritual has their own levels of reality, right? So and now in the West there is a movement towards this, and many books have been written on what is called the bio psychosocial framework for healthcare. So it's bio. So the disease has a reality in terms of the underlying biological processes. A disease or an illness has also maybe or combined with psychological factors. and also there may be like social or environmental factors, and then but believers, then we also bring into consideration the reality of Allah, of God, or as a creator, as the ultimate cause, as the ultimate reality, uh, governing all other levels of realities. So so ontological, so we have a hierarchical, multifaceted ontological understanding of illness and disease, and not restricted to the purely mechanistic bio bio or microbiological processes, right?
That's very interesting, Dr. Adi. And indeed, I think the implication of such cosmological and ontological understanding of reality has been put into practice by Muslims in the past. Like, for instance, I've read that during the Ottoman period, in the very even in the hospitals, due consideration is given to the design of garden surrounding it, such that it would potentially heal a patient and affect their psychological and spiritual health in a positive way. And so I think what you're saying is that, I mean, this is not something nostalgic. That it's not, although it has been practiced in the past. And you also said that the fact that there is a emerging movement or a framework that recognizes something similar, like what you're saying, which is called the biopsychosocial framework, um, uh, which can be adopted in healthcare as well. Um, Now, Dr. Adi, I was wondering whether you mentioned earlier about that how this cosmological and ontological commitments would necessarily impact methodology. It sounds like this is a long-term project. Do you see practitioners? Do you feel that this is something that, if they're interested, this is something that they can better understand about the cosmology and ontology by reading books? Is this something there ought to be a personal long-term commitment as well to be involved in a research program like this? How do you envision this being sort of being more acceptable by those who are interested in the field, or by students in the field, Doctor?
Right. Like in some countries like China, Korea, India, India, Pakistan, and also to some extent the West. There is a there are long established institution like research and education institution that that are into this holistic approach to healthcare. And for example, as I mentioned, traditional Chinese medicine, herbal medicine, naturopathy, Wani, the Arab, Greek, Ayurvedic medicine called Wani, Unani medicine. And so there is and so all that comes under what is called maybe TCM, traditional and complementary medicine. So and many doctors who have who were trained in the dominant allopathic biomedical framework, they have changed career midway, and they undergone a training and have so become a TCM practitioner. So but in Malaysia, I think there's need to be a more effort. I'm like there should be autonomous or independent, fully supported institution to support these alternative approaches. Currently, I think the situation here in Malaysia is quite ad hoc. I mean, individuals and association and with limited resources. Although there is, I think there is in the Ministry of Health, there is a section or a unit that gives some degree of recognition, but to TCM, but there seems to be more systematic effort and more resources put into that, and right, put into into these alternative and also time-tested alternative and more holistic treatment protocols.
Yes, and also I think in your article, Dr. Adi, you mentioned about how perhaps to move towards this direction, where that perhaps in medical education, students can be introduced to certain content which is not perhaps introduced enough. You mentioned the fact that perhaps foundation like preventive healthcare perhaps can be introduced, and perhaps the humanities side, as what you have been stressing a lot. Maybe there could be more exposure to philosophy and history of medicine, or even history of Islamic medicine in Muslim universities. But I mean, you've had some personal experience with this at ISTAC, at the International Institute of Islamic Thought and Civilization. What are your thoughts about having, more people in the field to bring in to stress the humanities side, so they could have a more reflective, critical take of the field, Dr. Adi?
Right. That's a good question. When I was at ISTAC during the directorship of Professor Syed Muhammad Nagir Alatas and his deputy director, Professor Wan Muhammad Noor, I mean, we had a very robust program in the history and philosophy of Islamic medicine, directed by Professor Sami Hamane, and we did many hours going through those texts and research into history, philosophy, and methods of Islamic medicine. And interestingly, when I was there, quite a number of doctors, like working doctors, that took time off during the weekend and audit the classes, right?
Yes.
So yeah, and even now, I mean, I'm in some doctors chat groups, and then quite a number of chat group focusing on TCM, on Islamic medicine, and these are chat group of doctors, like conventional doctors are looking for a more a larger perspective. So that means there is a market. I mean, there is a interest. Now the thing is that the conventional biomedical curriculum, there's not enough. I mean, students are very busy, but maybe the first year be more focused on comparative history and philosophy of medicine, and a critical history of Western medicine, especially post World War I, because that is when the biomedical thing really took off. So it's good to understand history of the current paradigm. So that's so I think that can be covered in maybe in the first or two semesters if you have good teachers, and then you can encourage a student to take elective, right? Elective, and maybe out of elective and maybe workshop and so on, or maybe take time to audit courses at classes, maybe if offered, and then there is and there should be more focus on nutrition, on food. We've got a lot of chronic diseases, right? It's due to food, it's due to lifestyle, food, nutrition, and diet. And that means there has to be some respect shown to herbal medicine. So and plus of course virtue and ethics and so on. The more, which is more focused into medical ethics, in which bioethics is taught as a subset, right? Not as the dominant ethical framework, right? So I mean, there's a way in which we can restructure the curriculum a bit without overburdening the students. So that's the one thing. I mean, is how to make the current biomedical curriculum more more open, maybe more comprehensive. But that said, there should be like a dedicated department, separate department on Islamic medicine, on any medicine, on naturopathy, or maybe separate a faculty of TCM altogether, right? So that people like doctors can be specialized in that. So yeah, so yeah, and of course, so and also the humanity. So and anyway, I mean that so in so I can think of right now. I can think of only one university in the whole world that is doing some serious work towards integrating all this into the conventional curriculum, including the humanities and philosophy of science, especially philosophy and history of medicine.
Right. And I think I'm sure if there are interested parties in Malaysia or abroad, they could reach out to you, Dr. Adi, under your advisory entity, Worldview of Islam Research and Advisory, to explore these possibilities further. Dr. Adi,
yeah. Yes.
Yes. In the remaining, I think we have about 7 minutes. Can you perhaps share your thoughts on the state of affairs, because you have spoken a great deal on the need for an Islamic medical research program. The implication of a lot of what you've discussed is that there needs to be a research program. To your knowledge, what's the state of affairs on this subject, and what is your suggestions if there are interested academics or practitioners out there to pursue this this project as a research program, Dr. Adi, and perhaps you could conclude your hopes and your hopes for the future in terms of how we should move forward in this field for the scholar, the researcher, as well as for the students. Dr. Adi, please.
Yeah, thank you. I think that's another good question, because when I finished that the article and it was reviewed by some doctors and also some philosophers of science and so on, and so one of them asked me to elaborate further on my proposal for an Islamic medical research program, which I mentioned in passing, because it was just a paper and already was too long. I cannot put too much stuff in there. So that paper was more about what is wrong now, right? Because if we propose the Islamic or any other alternative research program, that presupposes that something is lacking in the current system, right? So so the point of the paper was to show there is a this big lack, and for Muslim, a way to overcome that is to have like a properly conceptualized Islamic medical research program. And in that paper, I just gave a bare like outline there. But I plan to follow up with a second paper that would focus more on the topic of reviving Islamic the Islamic medical research program. But in any way, in the current situation, the Islamic medical research program, I think is most active in the India, India, Pakistan, but comes under the name of Unani medicine, UNANI, which is a combination of Islamic and traditional Indian Ayurvedic medicine. And but it's so 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 it's active, especially in India and Pakistan, and maybe a few other institute in other places in the world. But anyway, as regard the research program, first is like we need to take seriously the medical textbook. I mean, like economic tip and including indigenous, like Malaysia, indigenous Malay and Malay and also the tribal medicine, and to document that and to do research into the remedies, right? Especially the natural herbal remedies based on nutrition, based on herbs, and based on plants. So there should be like systematic research in that, and 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 uh, and right, and AI, and also research into non-interventive, somewhere like we talk about research into the emotional and psychological aspect of health, the social aspect of the social aspect of health. For instance, for example, like you mentioned, research into music therapy, like traditional hospital, how you set up the hospital. I mean, what would be the kind of hospital architecture and landscape that would be most conducive to health? You see, so a lot of people, when they are admitted into hospital, they find the ambience depressing, and 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 yeah, so you may get rid of the pathogen, but then the overall state, the ambience is depressing, and that can lower the person immunity, and get easily reinfected. And anyway, so garden therapy, it should be like garden with more like open air, and should be, and then look into the food, right? I mean, what's the point of getting treatment in hospital if you have fat junk food, right? Right. So it should be, and the hospital should also like organic foods and so on, and also research into simple remedies, simple natural remedies as a first choice of treatment, rather than just go straight away to complex synthetic pharmaceutical drugs, which in most cases have adverse effects and can cause dependency, and doesn't really heal, but it's more like a crisis management. But what I want to do is that we want to get the root of the problem, and therefore these are the type of research that can be done, and done on a very objective, scientific, evidence-based framework. So we are not talking at all about white medicine or subjective mumbo jumbo, but we are talking about a very exact science, and one that is less commercially driven and more public interested than the current big pharma commercially driven drugs with the patenting and so on, right? And monopoly over even essential drugs. So I think that that's a whole avenue of research. And to conclude, interestingly, when I was reading one of the, there is what okay, I was reading a paper, like a statement by a Malay Islamic scholar, right? And he mentioned that in the Malay world, the Malays, they have all these herbs, and and he said that they should do research into the traditional Malay local medical law, and research into some of into remedies that are stated in those texts. Alhamdulillah, I mean that a lecturer at IUM Kuantan and a few others have done splendid annotated translation of classical Malay medical text with even with a very detailed glossary of the corresponding modern medical names or botanical names for the plant, for the herbs mentioned. So we have enough. I think we have more than enough documentation, and medical researchers have no need to spend time learning Arabic or Jawi, and they can use the published documentation, right? And interestingly, a number of doctor researchers in the US, they came out with a very nice new look into the canon of medicine, right? The canon of medicine of Ibn Sina, and they've tried and they have in that book they re-articulated the Avicenna treatment protocols in terms of modern medical language. So if we have like dedicated, well-funded and well-supported institution, it can be a standalone college or can be part of a medical faculty, but with a autonomous institute or department focused on this. So there's simply no reason to think that medicine is only by way of the current big pharma controlled biomedical framework, right? Which is being criticized a lot, even in the West, right? By foremost Western thinkers and researchers, right? Including prominent doctors, right? So anyway, so that is kind of summarize the outline or the mapping of the Islamic medical research program.
Yes.
Right.
On that note, Tadi, again, it's been a real honor, and we've benefited so much from your insights, and we hope to host you again on Shaping Tomorrow. Ladies and gentlemen, you've been listening to Shaping Tomorrow on IKIM Radio with Dr. Adi Setia. This is our 4th episode for him, and the last one for this time, hopefully, inshallah. And Dr. Adi Setia is the coordinator of Worldview of Islam Research and Advisory, WIRA, to discuss on the question of Islamic ethics in engagement with life, health, and medicine. Thank you once again, Dr. Adi.
Thank you so much.
Thank you. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.